Now moving on to something which we all are longing to happen, a vaccine. One can really only be safe when a vaccine is available. So that's one of the biggest challenges today, is how to develop a vaccine and to do it in the shortest possible time. But it's not easy. If you look at vaccines, and let's look at some of the stages that go into a vaccine. When will we have a vaccine? Vaccines have taken years to develop in the past. Can the whole process be speeded up? So let's have a look at what exactly is a process. There are 10 steps. First, of course, there's academic research. That can be squeezed in time. Now, preclinical trials. You build a pilot factory. This can be done very fast. It doesn't need to produce a lot of vaccine. So it's preclinical. It's just very, very early. Then, after that is cleared, you have phase 1 trials. Now, this is where you test on just a few people, a few dozen people. You just test the vaccine on them. Next is phase 2 trials. There you go from a few dozen, you test on a few hundred. And this takes a little time because you have to see the impact of the vaccination and whether it's having an effect. So you do it on 2 types of people who are given placebos and people who are given the actual vaccine. And I'm told that the vaccines sometimes, particularly in this, are quite painful and you can lead to temperature. So you don't just give salt water as a placebo. You have to give it to the people who are not getting the vaccine. You have to give them something which also gives them fever and pain. But it's not the actual vaccine. So it's got to match. Nobody knows, because there's a psychological effect as well. So they shouldn't feel, I've just got a placebo, I'm fine. Then there's phase 3, and this is a test on thousands and thousands. Now, phase 1, 2, 3 are all on humans, and this is very, very important to be careful at this stage. We're talking about now making all phase 1, 2, and 3 together, compacting them, but it is a dangerous path because you give a wrong vaccine and there could be side effects that could be terrible on the volunteers for these trials. Okay, let's say you've passed all these, and these take a few months. You have to build factories to produce, and generally factories are vaccine specific. Although what we have found is that we've worked on this kind of virus, SARS viruses before, so some of the vaccine factories can be repurposed perhaps for the coronavirus 2, SARS-CoV-2. So this could perhaps be speeded up. Moving on, then you've got to manufacture. You have to manufacture billions. That's going to take a little bit of time. Then moving on, you need approval all along from the authorities, the FDA in Europe, the regulators, our own ICMR, etc. But they're saying that they may speed up the clearance based on, it can be used for emergency use. FDA EU it's called, emergency use. So that could be speeded up. Then you have to distribute. And there's a bit of a worry here that the richer countries who can pay lots for all these vaccines and have all the power will tend to get it before the poorer countries. And this is where the WHO, the UN, and all the emerging markets need to come together with the developed countries and say, look, this is a global crisis and let's collaborate. And finally, stage you get final immunity if everything goes well. But those are lots of stages. So don't think that, why aren't we getting a vaccine faster? I mean, that just a lot of stages, and those are necessary stages. I mean, just to give us an example of let's look at some vaccines in the past and how long they've taken. They've taken over 10 years, most of them. Let's have a look at some, for example. Take a vaccine, take the first one, varicella. That's a vaccine against chickenpox. That took just 28 years. We're talking about 18 months. We want this in 8 months or 3 months. The HPV, which works against various kinds of cancers, preventive, that took 15 years to develop. Moving on, the rotavirus, that's for diarrhea in small children, very, very important. Diarrhea in small children really is a big killer in India, as Atul Gawande has pointed out. That rotavirus took 15 years to develop. And then there is a pediatric combination. It's a combo where children can take it for several different kinds of diseases which children get. And that took 11 years to develop. So what are we looking at now? We want the SARS-CoV-2 COVID-19 virus in 18 months, and people are saying, oh, that's too long, 18 months is far too long.